Good evening. My name is Ajit Sachdeva, and I'm the Director of the Division of Education at the American College of Surgeons. I also have the honor and privilege of serving as co-chair of the steering committee of the ACS Academy of Master Surgeon Educators. I would like to warmly welcome all of you to the inaugural Fireside Chat of the Academy. And I'll give you a short background about the Academy and about this series. About 3 months ago, the Academy decided to appoint a special committee to look at the impact of the COVID-19 pandemic on surgical training across all surgery specialties. With that in mind, the special committee appointed to look at this area created a couple of different domains of focus, and one of them has been the use of novel teaching and educational strategies. That subcommittee is chaired by Dr. Moshe Shabahang, who is the chair of the Geisinger Surgery Institute. The Academy, through the subcommittee, has embarked on a couple of new elements and new programs that have been very successful and are very timely. One of them is the virtual Grand Round series, and we inaugurated that last week with an extremely successful session. And this evening we have our inaugural Fireside Chat. I'm delighted that Dr. John Mellinger, who is from the Southern Illinois University Department of Surgery and will be formally introduced by Dr. Shabahang, is going to be our first leader of the Fireside Chat. The Academy itself, for those of you who are not familiar, is about 3 years old, and it was established to recognize the best of the best from the world of surgical education, and then to engage these surgeon leaders in advancing the field of surgical education. Before I turn the floor and this virtual meeting over to Dr. Shabahang, I would like to thank Dr. Mellinger for his willingness to share his expertise with everyone. A special word of thanks to all of you for being here with us. And of course, I'd like to thank our wonderful staff, Rachel Newman, who's been a chief architect of supporting these sessions, the core staff of the Academy, Dr. Lisa Nagler and Susan Newman, and our e-learning team, Olivier Petineau and Sancom. So with that, let me turn the microphone and the meeting over to Dr. Shabahang to introduce Dr. Mellinger and to get the session underway. Thank you and welcome.
Wonderful. Thank you, Dr. Sachdeva. It is a great honor to be starting this Academy, the series of Fireside Chats. The purpose of this for us is really to give a chance for faculty of surgery and learners who are planning on going into surgery to have a more intimate, have an opportunity to have a more intimate conversation with some of the more prominent surgical educators in the country. And so it really is an honor to introduce Dr. Mellinger, who's graciously accepted our invitation to be our first speaker and participant in this program. More will be coming down the pike in this program series, and more announcements will be coming out. Dr. Mellinger, and I actually am going to let Dr. Mellinger talk a little bit about his career, but suffice it to say that Dr. Mellinger is the Roland Foltz Chair at the Southern Illinois University for the Department of Surgery, and also the President of the American Board of Surgery. After last week, Dr. Mellinger said he may not want to participate in this, but we are thankful for him participating. So John, I think maybe we'll start the evening, and let me just take care of a few housekeeping issues that Rachel made sure that I do take care of. All attendees are muted, but you can unmute yourself. Obviously, we would love for you to have your cameras on so we can see you, so please feel free to do that. Please feel free to submit questions either through the chat box or down the line, raise your hand, and we will have you state your question, but feel free to use the chat feature of the Zoom appointment. This session is being recorded. It will be posted on the Academy website, and there is an evaluation at the end that will be in the chat box. We would love for you to fill out the evaluation and share your thoughts with us. So without further ado, Dr. Mellinger, I'm going to let you talk a little bit about yourself and your career path and how you got to where you are today.
Thank you, Mo and Satch, and all out there for the privilege of having this time with you. I'm very honored to be part of this series from the ACS and the Academy of Master Educators. Very privileged to participate in this way. I am sure that our time will be better spent and more enjoyable if the focus is on the dialogue part, so I'll be brief in saying anything about myself. I think two things I thought about that I hope might be encouraging to the students and maybe residents or younger faculty out in the audience is that I have found that career paths are often not what you plan them to be, and that's part of the joy and the fun that's involved in them. So my journey has been more organic than planned ahead of time. If you'd have told me 30 years ago that I'd be doing what I'm doing now, I probably would have laughed. And if I could cite just a couple lessons learned, I think one thing is to follow your passions and look for ways to leverage and grow them. For me, that ended up being education. I knew I enjoyed it in my student and residency years. I don't think I had any idea that it would end up being as important a part of my career activities as it has become. And so follow your passions would be one point. Listen to people around you and look for opportunities to spend time with people around you and in settings where you can grow those things. And the college has been a great vehicle for that for me. The Surgeons as Educators course, which I took as a sort of junior to early mid faculty member, was a life-changing event for me from a career standpoint because of the way it captured things that I was experiencing but hadn't really been able to give a structure or logic or outline to, and really helped me do that, and also gave me a network of people, some of whom are on this call, who became friends for life and stimulators of me in my career path. And one other thing I would cite is that I've found that taking a curricular view of your career path, not only including, but especially including the disappointments and unanticipated challenges, is really where growth comes from. And the biggest opportunities that have come to me have often come out of leaning into a challenging experience that wasn't what I hoped it would be, wasn't what I expected it to be, but offered the opportunity for growth that I otherwise would not have had. And again, mentorship, being surrounded by colleagues that can encourage you in those things and teach you things in the process is very important. So those are just a few thoughts I'd share. And I think I ought to stop talking about me, and maybe we can get into some of the questions or other dialogues we should have. Thank you again for the privilege of doing this.
Thank you, John. And obviously tonight, we do want to hear about some of your experiences. And again, for the audience, we would love to have your questions either by raising your hand through the animation or putting it on the chat box. And so please feel free to do that. John, some questions that were submitted prior to this had to do with words of advice for MS4s who were MS3s or MS2s during the last part of last academic year, during the COVID, when the COVID struck. And the question was really, what words of advice do you have for some of those MS4s who are applying to surgical residency and surgical fields during this period that obviously has been tumultuous?
It's a great question, and one I think everyone in surgical education is wrestling with right now. This class coming into their fourth year is already navigating things that neither programs nor applicants have had to navigate before. The whole prospect of a virtual interview process, the inability to do away rotations that many have used as ways to sort of audition for programs that they're especially interested in, maybe to recruit other letter writers. The missing of the latter part of their third year and rotations that they had counted on at many institutions not being able to be done, and just kind of getting back into the saddle this summer, figuring out how to navigate all that for people that weren't real sure of their career choices and were relying on sort of the tail part of their third year. So significant stresses on this group. I would just offer a couple things off the top. One is I just want to compliment this class. I would say this of the residents in residency training now and the recently graduated chief class. While you are encountering challenges that no one else has, I think this has kind of become a defining moment for this generation in ways that my generation frankly didn't have, around what it means to be a professional and what professionalism and service in medicine and surgery specifically mean. So I just want to say, don't lose sight of the fact that what you are learning from this experience, including the challenges of it, will likely be one of the things you look back on as a source of real maturing and wisdom. You know, this might seem a bit grandiose, but Churchill's line to England as it was being bombed incessantly by the Nazis, that one day people will ask you, where were you in England's finest hour? I think in many ways, the way the younger generation has stepped into the pandemic, provided care, been on the front line, sacrificed their own interests in ways that students and residents have not had to in recent memory, is just really something to cherish and to dive deep on. So I would encourage you to view it as a strength as well as a challenge that you will have in the aftermath of this. In terms of navigating, one thing I would emphasize is I think this is a time to really lean into your local resources for a couple reasons. Losing opportunities at other places that you may have otherwise counted on for away rotations, et cetera. Your local faculty relationships, the reputation you build at your own institution will, if anything, be even more important. It's probably always one of the most important things. There's no testimonial or letter of reference that is more powerful than the one that comes from somebody who's worked with you directly and can say things about how you bring special things to the table, whatever those are. It may be your cognitive and academic skill. It may be depth of character. It may be technical aptitude. It may be teamwork skills. It may be the kind of person that gets humanism awards from their fellow classmates. It may be the person who has remarkable volunteerism skills. Whatever those things are about you, somebody needs to be telling that story for you. And I would work hard at cultivating those local relationships and using them as pathways to make connections at other institutions with other programs and program directors. Many program directors have been saying that they feel this year may be a year that they're more likely than perhaps in recent years, other years, to select some of their own students because they will be known entities. So I would strongly encourage you to cultivate that base. The second thing would be through them to develop some of the, again, networking and outreach opportunities that they can help provide to programs they've trained in, places they've worked, faculty member at other institutions they know, and having a frank, realistic discussion about your aptitudes and abilities and where a good fit for you might be will be very crucial this year, because you won't have as many means to sort that out as perhaps prior classes of students had. I would also recommend that if you have relationships with the recently graduated student class, and specifically people in that class from your institution who interviewed for surgery, since that's our theme tonight, use those people to glean things about programs that you may not have the opportunity to gather yourself, and that represent a student's updated perspective about those places. And finally, I think there's going to be a lot of resources coming to bear. This group that Dr. Sachdeva has referred to and that Dr. Shabahan is helping lead at the college, and many other groups, many of our journals are in a very accelerated way seeking to disseminate strategies around how to prepare for a virtual interviewing process, how to navigate other aspects of the COVID challenge, both clinically and educationally. So keep your ear to the ground, both locally and through channels like this tonight, to avail yourself of those things and prepare yourself. Those would be a few of the thoughts I might offer.
Great, great. Every once in a while, I look to make sure that there are no hands raised, but please feel free to. This is meant to be a participatory kind of environment. So if there are any questions, please shout them out. Otherwise, I'll keep going with questions here. John, there was a question that was posed earlier by one of the participants. They said, how early on did you decide you wanted to be a surgeon, and how did that decision making come about?
For me, I went to med school thinking I wanted to do surgery. It ended up being for the wrong reason. I thought at the time, honestly, I thought I was preparing to be to work as in medical missions work and in a global health setting, and surgery seemed attractive because it was so versatile. It seemed like you could learn some tropical medicine and learn some other things that might be important in those settings. But if you had surgical skills, it opened up so many possibilities to care for the really overwhelming need. And this generation of students is very tuned into global health needs. You know many of the statistics, but just as an example, in sub-Saharan Africa today, there's about 50 million people that need an operation now, and most of them will never get it. So that was very motivating to me as a student. It's what I thought I was aiming to do, and that's why I went into surgery. My career path, and that we don't need to get into that story, we ended up taking different directions. And so I've had the privilege of working and supporting people in a teaching and other modes who work in those settings, but I haven't done that directly. I would say to the student that asked that question, I think it's very important to sort out what's the kind of work you can do as a doctor that, you know, as has been said before about any choice about your work, to try to find something that you love doing so much it's not work for you to do. And one of the ways I knew that surgery was that for me, apart from my aspirations at the time that ended up not being quite accurate for the future, was people near me commented about how much I seemed to be enjoying the kind of learning I was doing, the kind of work I was doing. I would come home from some of my other rotations at 4 in, and they'd say, you don't look like you had that great a day. I'd come home after a 36-hour shift and an overnight on my surgery rotation. They'd say, you seem to want to go back and do more of that. And it's important to listen to those voices, and that sort of what people can help us see that we might be blind to ourselves. I think the set of skills that are really important for someone who's interested in surgery include work ethic, team skills, the willingness to cultivate humility, because I think it's important in judgment, and judgment is a very significant part of what we do as surgeons. I was told when I was in training by an internist that the main reason my training took longer than his was that I was going to hold things in my hand that were more harmful to people than most of the things he used, and extra judgment was required. And that was the main thing the length of my training was meant to teach me. I do think you have to learn to hold very carefully the things that you're entrusted with in surgical care. So I would not say that if you've decided late in the game that that's what you want to do, you've made a bad decision. I would align it with those kind of principles. And for this, maybe if there's students out there that are just starting their third year, I think a wonderful way to approach this is to view every rotation you do as what you might want to do the rest of your life. Fully invest yourself. As one of my residents said years ago, the world belongs to those who show up. And I think if you invest yourself fully in every rotation, it'll become clear over the course of the year where your deeper joy, your deeper passion, your greater fulfillment, your greater impact on the people you're working with was evident. It's a really good question.
I'm seeing one of our questioners, actually, I see your name, Supriya Shah, and I was going to ask you if you want to ask the question that you had posted yourself. I would much rather, I think you would do more justice to the question than I would. So maybe I'll ask the question then. The question was, are there one or two things that's critical for junior residents to work on to reach a higher level of competence and proficiency?
It's a good question. I do think there's some differences in what junior and senior residents are looking for and maybe what they need to focus most on. It's interesting. Over the years as a program director, I saw a little bit of a pattern that residents would sometimes say about faculty. They're really good attending for junior residents, or they're really good faculty for senior residents. And the reason was, as you dug into it, that the residents recognized there were some different learning goals at those two levels. What they meant was that when you're a junior and going to the OR and you need somebody to lead you through a case, there were people who were really good at making that a profitable learning experience. But then at the senior level, most of the residents really were seeking to grow in autonomy and confidence and independent ability. And they needed attendings who were happy to be less hands-on. And those weren't always the same faculty. So that might reflect from a resident or learner's perspective some of the differences that are common. I would say junior learners, building your cognitive base is incredibly important. And like so many things in our journey, it's laying the foundations that allows other things that are good to be built on top. So I think if the junior learner focuses on really leveraging their knowledge of the cognitive foundations of surgery, developing good work habits that lead to efficiency and how you manage complex and frequently interrupted tasks such as surgeons have to deal with. And in those contexts, making sure that that doesn't mean you don't get to the OR at all. Getting to the OR and watching, even if you can't do some of the cases as a junior resident, really helps set you up understanding patterns of OR behavior, communication, sequences in operations, exposures that end up being fundamental to being successful, doing the more complex things as a senior resident. And then at the senior level, I would say judgment, developing leadership capabilities with OR teams and managing teams of residents, and definitely leaning into the most complex cases that you can be exposed to because of what it teaches you about how to exercise judgment, how to blend complex work duties. And then one other thing I would say again that just pertains to this theme of leaning in. My residents heard us talk about this just a week or two ago, but when I went to my first M&M conference at an intern, our program director, a man named Kai Johansson, looked at us and he said, if you show up and really listen for the next 5 years at every M&M conference, when you're done with residency, no matter what else happens to you or you encounter in your clinical duties, you will have heard almost every possible complication discussed that can happen in the course of caring for a surgical patient. And it really is up to you whether you show up and listen and participate and glean that. So one thing I would say is whether you're junior or senior, whatever you are, really lean into every opportunity you have. Our education system, for the problems we do have, and there are many things we still want to work on and fix, and many of us are spending time on that, is still one that's the envy of the world in training surgeons. And lean into those opportunities if you're part of the system and have that before you.
John, in order to highlight something you said, if I may, so what I'm hearing from you is in the junior years, the cognitive aspect becomes important, and in the senior years, it's more the technical parts and maybe the non-technical parts that need to be mastered. Is that a fair highlight?
It is, maybe with the caveat that, you know, the board a few years ago established a policy that residents needed to have 250. It's sort of a broad, they're not all operations. It can include things like chest tubes and central lines, but broadly, by the end of your second year, we wanted people to have 250 such experiences. And the reason was it was recognized you couldn't put off all your technical development till the mid or senior years. There's a trajectory to that. And so, so with that caveat, I would say yes. In my own journey, I found that the way I got opportunities in the operating room, the way my attendings decided they had confidence in me, the way my senior residents felt I was playing my role on the team, was I had to be reliable on the floor and in the ICU, and I had to do it efficiently enough that I got to the OR to watch them work and could assist and retract. And so the way I did that was to build a cognitive base that was useful to them, and to me, it allowed me to make independent decisions as it grew. It allowed me to be an effective team member, not calling them for as many things as I matured. We all call about a lot of things at the outset. So that was one of the ways I built credibility as a junior resident, if that makes sense.
Great. There's a question regarding preparing students for mock virtual interviews. And Maria Altieri was asking, how are you preparing your students for mock virtual interviews? A new experience for all of us.
You know, I think, and Mo, I know you've been thinking about this a lot with this special committee and one of the publications that's going to come out soon. You told me right at the start of this call. Way to go. But I think there's a couple things to be thinking about. One is really to have a engaging personal statement that really allows you succinctly to summarize who you are, why you want to be a surgeon, and shows hopefully something deeper about you. We tend to be very tactical with many things in life. And yet when we get beyond the tactical to our underlying values, the things we hold dear, what makes us who we are, we start to reveal something different about ourselves that's important to others and for us to know. So I would encourage students to think a lot about your personal statement and recognize that you may have opportunities to do that as a video. I think it's likely that many programs will use introductory videos to tell applicants about what they do, introduce them to key people in the program, provide the background information that normally a program director might offer in sort of a lecture format at the start of an interview day. Applicants usually have some similar opportunities. So the personal statement, I think another thing to think about is how you can present yourself well in a video forum. And most of us learn the first time we see ourselves on video. It's quite terrifying. And so I think practice would be something to engage in. You know, video yourself, giving a little talk, giving an introduction, answering some key questions. Your school and your surgery residency program director and faculty at your school likely have some well thought through ideas about what they're going to do when they interview applicants, picking their brain about what kind of questions should you be prepared for, having some well-rehearsed answers that are accurate reflections of you know, what you want to say, and rehearsing those in a video format, I think would be wise. I think it's going to be different for all of us. What program directors are thinking about is how do they get beyond the superficial things in this medium? What, Mo, you and I have heard in some of the conversations leading up to the paper and all, folks say, I got to have that handshake. I got to have that eye to eye. I know in a few minutes what I think of them, but I got to have that and I'm not going to have it. So thinking about ways you can show up and really show who you are, I think would be my main piece of advice.
Excellent. And saw Maria's name here. I don't know if you have any follow-ups to that. Just pause for a second in case you do. John, when we started tonight, one of my concerns was that most of the questions were going to be about your role as president of the ABS. And actually, we haven't gotten any questions. So I just want to go there for a second and ask you what that position has meant to you, what you've taken from it, and what you're hoping to what are your hopes for the American board?
It's gracious of you, Mo. The experience of serving on the board, which I got to do beginning 6 years ago, just over 6 years ago now, after being nominated by the Program Directors Association of Program Directors in Surgery, has been a truly amazing experience. I'll give you one example of how I was quickly shown how moving an experience it is to have an opportunity to do this, and I'll explain why I think it's so. At my first board meeting, we got to listen to the outgoing board members, so people who had served their 6-year term and were now rotating off. And I watched men and women who, some of whom I didn't know well, but I knew who they were. And I had perhaps read their book chapters or their books or their articles or known of them as very influential people in our field. And I watched them get up and cry and say, this has been the most important and moving experience of my career. And the reason had nothing to do with some kind of honorific ideal. It had to do with the fact that they had spent 6 years, and it takes about a month of your time each year to serve on the board. If you add up all the things you do, all of which are done on a volunteer basis, it's a stewardship for the profession of the standards that we own to serve the public well and to serve the people in the profession well. And the responsibility and the feeling of the value of doing that for your colleagues, and most importantly for the people we're there to serve, our patients, is a profoundly moving experience. Now your question about my hopes for the board. So because of what happened a week ago today, my hopes for the board is that we survive. No, I would say the board is in a wonderful place to do some really amazing things in the years ahead. In the last few years, the board did a very self-reflective deep dive into its own function and efficiency, and had developed an aspiration out of that to change some things to help us be as high performing as we possibly can. Changed our governance model, developed a new mission and vision statement, brought in a new CEO and president, Dr. Joe Beiske, who's been fantastic, all building on a long-standing, very strong tradition. So my hope is to basically be a steward of that group of people alongside them, not in some kind of hierarchical leadership way, but just to be one of a team that I think is doing some amazing things. And especially important now with this whole COVID challenge, the educational implications of it, as all know, or many probably know on the call, having had a meltdown over virtual proctoring with our qualifying exam, our main written exam for people achieving board certification just last week, despite best of intentions, best of efforts, and trying to navigate within a set of moving timetables with necessary lead time to do all the things we do to make them valid, good, psychometrically solid, and worthy of saying we're upholding the standard of the profession. So that would be my hope, just to be a good steward with some really wonderful people to work alongside of.
Sounds great. Carla, I see you're raising your hand. Please go ahead. Great.
Can you hear me?
Yes, we can.
Can you hear me? Oh, wonderful. Thank you so much. Dr. Mellinger, I know, John, thank you so much for spending time with us. I have watched your career and have really admired your leadership and just your humble presentation to our profession. It's been an honor to watch you lead in surgery. And when I think about all that you've accomplished with pretty much having every important leadership position and having such a full perspective of leadership in our profession, I wonder for you, what is it that you dream about for our profession? Like, I can't see that you could stay with this at the level that you have and the vigor without having some secret dream that we may not know about that keeps you motivated. What is that?
Boy, what a great question. And for those of you that don't know Carla Pugh, Carla's a tremendous leader in our field. Her work in simulation and skill development and in many areas of surgical education has been absolutely outstanding and illuminating to many in our career field. So thank you, Carla. Why? That's a really wonderful question. I would say two things that come to mind. Well, maybe three. The one thing is, it has been a real stimulus, antidote to burnout. It gets me up every morning, truly, to invest one's career energies in developing the next generation. It keeps you young. It's part of our Hippocratic tradition. It's what we commit to when we take that oath. It's a way of expanding your service. And I would love for our profession to keep its long-term eyes on doing the very best it can to continue to develop the next generation of surgeons, the people that'll take care of you and me when we're old. That's longer off for you than for me, Carla. But that's one thing that's been really important. The second thing I would say that is important to me is something that a couple of our leaders in SAGES have been promoting this year. Horacio Asbun is the president and Leanne Feldman is the president-elect, and they've started a reimagining surgery task force that is focusing on, I think, a really important theme. And as we think about all the literature about burnout, I'm sure the students and residents on the call have heard this, escalating rates of burnout. We all know the many pressures that people feel they're under. I think we've been in danger of taking a very defensive mindset about how we respond to that, with coping mechanisms, mitigation strategies, how to help doctors be rubber bands that can stretch further and further, resilience, and all that's good, and that's part of the equation. What we haven't done a really good job, I think, of is taking the offensive and saying, what's totally awesome about what we do? Some days, if I hear a couple older surgeons, I have to be careful I'm not one of them, complaining in the locker room about decreasing reimbursements and increasing time on the EHR, and I see some students kind of listening on the conversation, I try to pull them aside and I'll say, can you name me another job where the first time you meet somebody, they trust you with things that are really the most precious things in the world, their life, their family's life, where you get to work alongside some of the brightest and best motivated people in the world. And every day, that's the environment you get to function in. And what you do actually really matters. And don't ever forget that. Don't get focused on money. Don't get focused on prestige. Don't get focused on reputation. Think about what a privilege it is to render that service. So I'd like to see us as a profession take an offensive on those kind of themes like that task force is working on. And then I'd like to see us develop new ways of being accountable and becoming better at lifelong learning. So some of the stuff you're working on, Carla, like video-based assessment and coaching strategies, and how can we turn everything we do in the workplace, not only for our learners, but for us as old learners, into a growth and improvement opportunity. I think that'll keep us all going.
So John, I think Nehal Kamas I'm going to call on you to ask your question. Appreciate you putting your question on the chat box.
I see her question if she's not able to.
Yeah. Can you hear me now?
Yes, we can.
Okay. So thanks very much for the Academy, for the opportunity of today to talk with and to hear to the wisdom of Professor Mellinger. And I would like to thank Professor Mellinger for the lot of support he gave to the ACS Faculty Development Committee, for the Article of the Month series, for our workshop on operative skills assessment, and many other in-person consultations. My question for today is actually, over the last years, there have been a lot of innovation in the field of surgical education. However, this lot of innovations and great developments have not been really get into implementation with the same pace of the development of those innovations. And one of the reasons that is mentioned within the literature, and we all notice, is the lack of dedicated educators from within the programs. And sometimes this is estimated to be just like only 25% of the programs have dedicated educators, like to go for faculty development, implementation of curriculum innovation, and so on. So in your opinion, Professor Mellinger, how we can overcome this, and how can we get it more speedy to see the innovations in surgical education getting into implementation and resulting in better satisfaction and less concerns from the sides of the program directors as well as the trainees? Thank you.
It's a very good question, Nihal, and thank you, and thanks for all you do, by the way. It was neat to see your email recently about developing EPAs for Saudi Arabia. That's really cool. So you ask a really profound question. I think the ball is moving, and I think we're going to benefit from this, but over the course of my career, I can tell you that I won't get too specific because I don't want to betray people I hold dear, but not terribly long ago, my chair, when we were talking about my future, I'm not talking about where I'm at now, but in some of my earlier career path, and I mentioned that I thought education and educational scholarship was where I wanted to put my focus, said that they were concerned that that wouldn't lead me in a productive direction career-wise. So it's not been that long that education's been seen as a truly legitimate academic pathway within our field. And like so many things, gender, race, there's a number of things that surgery has been behind even some of the rest of the medical profession on. And I'm not sure I'd say education's in that category, the same category as gender and race bias, but it's definitely an area that I think throughout medicine, it's been slower to achieve the kind of stature as a solid research portfolio, a very productive tertiary or quaternary clinical practice, et cetera. There was a study on burnout I saw a few years ago that correlated burnout in faculty with whether you got to spend at least 20% of your time, so 1 day a week basically, in whatever area you were most passionate about in your practice. The main areas being research, clinical care, administration, and leadership or education. People whose passion was education were the most vulnerable and the least likely to get to spend at least 20% of their time dedicated to that passion. So this is still something, you're highlighting an issue that we're still moving out of. I think the lot has changed. Part of it has been because of people like Carla and Mo. There's really wonderful people in leadership roles in surgery nationally who have very effectively done research and education and turned it into a legitimate academic path. I think we've also been forced in recent years to look very creatively at education because of things like duty hour change and other pressures that have really compressed our training environment. We've definitely been forced to think about how do we get better, not just how do we add more on, how do we make better use of the time we have. So So I'm describing the problem maybe more than the solutions, but I think one thing would be, there was a book about change management years ago called Switch by Heath and Heath. And one of the things they talk about, if you want to initiate change, you celebrate people who are doing the things that you want to see done. So I think within academic departments, and there are many around the country, and I could name off the top of my head 10 or 20 probably, where educational growth and educational scholarship and educational innovation have in the last 10 to 20 years started to become a cornerstone of what the department is doing in a way that was not true 20 or 30 years ago. So we need to celebrate that. And then we need to learn from those people best practices and apply them. The ACGME, the ACS, the board, many groups are really focusing on faculty development ideas right now and seeing that as a key need. So that's taking it not just to the champions, but taking it to the average faculty member. How do we help them be better teachers? And I think technology will help us with this too. One example would be the simple app that many are now using for operative performance ratings, or homegrown apps that do similar things that were developed at a number of institutions as part of an EPA pilot the board was involved with the last 2 years. So leveraging technology, elevating the performance of all faculty through faculty development, and celebrating real champions and leaders as people who have used education as a viable academic path and impacted a lot of lives in doing so, I think are a few things I'd offer as answers to that question.
Thank you very much.
Thank you, Nehal. I'm going to pause and see if there are any other questions that people want to state. John, as we wait, I want to ask you, please go ahead. I think.
Hi, this is Patrick Nguyen. I'm in San Antonio, Texas. Thank you all for hosting. We do appreciate it. We actually just had a general surgery applicant symposium, which we have every year for our students applying to surgery. And what we had a couple residents who went through virtual interviews who gave really good insight as to how our students should prepare for interviews. My question to you is, Dr. Dent, when a question came up about, now it's much easier for a student over a 3-day period to be able to interview in Seattle, in Chicago, in New York, and maybe on the 4th day in Texas. It's just way easier in the virtual setting to interview at more places. And so it's hard to counsel these students. Should they do a bunch more interviews versus stick to the recommended 10 to 12 appropriate selection of programs they might be interested in?
It's a great question, Patrick, thank you. And thanks for bringing up the point about using residents as a resource. Some of the fellowship application processes were already impacted this past year by COVID and went virtual, and that's a very rich resource to learn from people. And Dan's a great educational thinker and does a lot for the program directors, for the board, for the college. You've got a great educational champion there. I don't think at least I don't feel like I know what to tell a student about how many places to apply to. As you said or alluded to, statistically, in a historical sense, if you interview at 10 or 12 programs, you had like a 90% chance of matching. And that in an era where it cost students so much by way of resources and time to do that, it made sense to draw that line somewhere. I think there is a likelihood that students and programs may consider interviewing more people this year because nobody knows quite how this will play out or if there will be differences. My guess is that well-chosen sites to apply to that are a good fit for that student and their profile, whatever strengths, aptitudes they have and what that program looks for, will still map out to lead to a good chance of matching. But I think people are nervous about it, much like your question implies, and I don't know that I have a better answer than I would. If I was applying this year, I think I would apply to any program that I thought might legitimately be a good fit for me. and I would use the resource stream benefit of not having to fly all over the country to my advantage, and looking at programs I might not have otherwise considered.
Thank you.
Thank you for the question.
Any other questions?
There was one question I saw on the list that someone turned in ahead of time. I was just going to really briefly comment on because I like the question. That's probably the only reason to offer an answer. But the question was, is there a skill or quality which is underemphasized in surgical resident education that you feel is important? And I do have some quick thoughts about that. And it goes back to a very old model. So way back to Aristotle, he had this model for the areas we need to grow in as we develop. And it was cogne, techne, and arete. Cogne is knowledge. We all get that, and we've already talked about that. Techne is skill, including for us as surgeons, operative skill. We all get that. Arete is virtue or character. And Carlos Pellegrini, who was president of the college a couple of years ago, in his presidential address, addressed this issue some, and I thought in a very powerful way. But I think that residents need to remember, and students too, that they're becoming someone as they go through their training. It's not just about being knowledgeable. It's not just about having skills, but it's about becoming a certain kind of person who's a worthy steward of the trust of someone else for their life and their health. And I think that involves growing in ways that we often have left out of the equation as surgeons because we tend to be very busy. And it involves staying true to the things that made you whole, that brought you to the point where you wanted to be a physician in the first place. It involves core relationships. It involves issues of faith and disciplines and habits in our lives that keep us whole. And I think where there's a temptation in medical training in general and surgery training specifically to think you can hit the pause button on that for a decade and then just pick it up again. And I don't think that's true. The time we have for some of those things may be different in different phases of our lives, but trying to be careful not to let them be totally eliminated and keep us growing as people and becoming a certain kind of person with depth of character to be worthy of caring for someone else is one thing I would say in answer to that question.
Great. Thank you, John. And thank you, Samantha Knight, for submitting that question. John, I want to take the prerogative as we're getting closer. It's about 8:54. Both ask you kind of for any final advice, but I also want to ask you, you've been in many leadership roles, the president of the APDS, president of the ABS, chair of a department. What is the fun, and you've alluded to many of the lessons learned, but maybe what is the final thing, last thing, or parting word that you would like to leave with the group about the value of leadership and what you've learned and what you've tried to do in your leadership career? And then any final comments that you have for the group.
Maybe I'll share two things. Mo, there was a quote I saw recently from a guy named Max Dupree, who was CEO at Herman Miller, a company that makes clocks. And he had this comment about leadership. You mentioned leadership. And I think it really captures a lot. He said, the first task of the leader is to define reality. The last is to say thank you. In between, the leader must learn to be a servant and a debtor. I thought that captured an awful lot. It captures the privilege of leadership, that at the end it's something we hold with gratitude. It captures the start of it, that the leader's job is to look at challenges, to look at nuts and bolts, help define what we really must do to navigate, survive, thrive. But in between, it's all about service. It's all about feeling a debt to everyone, to your patients, to your colleagues, to your students. And when you can approach it that way, it's very hard to go wrong for long. We go wrong quickly when we get our eyes on some other things. So that's one thing I would offer. The other thing that I thought about when you asked about something in closing, many on the call may know of Selwyn Vickers, wonderful man who's the dean at University of Alabama, Birmingham, a surgeon, has been a leader within the college, has been on the board, wonderful, wonderful man. I heard him give a presidential address a few years ago, and he was asked about balance. And this pertains to so many of the things we've talked about tonight, and is often on the list of concerns I hear from students and residents. How do you balance all this? Can I have a family and be a surgeon? Can I do this kind of surgery and still have this part of my life? And he had this wonderful analogy, and he said, I have to say, and I'm paraphrasing, if he listens to this, I hope I'm getting it close to right. But he said, I don't know that I've ever had balance. If by balance you mean that everything was in the right proportion all the time. That hasn't been the way my career and my life have been lived. There have been seasons that my family had needs, and I made decisions in my career to honor my family needs. There have been seasons where my career path demanded things of me that made me put in things and investments that I wouldn't have done for my to my family, but I had to. But he said, what I will say is it's like an orchestra almost. There's rhythm. There's not balance, but there's rhythm. And one section may play louder than another at one point, but I never excluded that part of the orchestra and lost it. And I love that analogy. And there's seasons in one's life. So the thing I'd say in encouragement to students and residents is keep the different parts of the orchestra involved. There may seem to be seasons they aren't playing at the level you'd like them to, but don't drop them. And a lot of things out of that harmony will become really productive and fulfilling in your life.
John, you've left us with so much to think about, and I think your final comments really leave so much to think about. I think on behalf of our subcommittee and the Academy of Master Surgeon Educators, I want to thank you. I want to thank our staff. I want to thank our participants, all the people who put in questions. But John, thank you so much for being the first speaker. And Satch, I'm going to defer to you for a closing comment.
Thank you so much, Mo. I think John has shared so much wisdom, and his inspirational leadership has really shaped surgery, surgical education, and many careers. So thank you, John, for sharing your wisdom with us, and thank you, Mo, for organizing it, and thank you all for participating. And once again, thanks to the staff. Have a great evening.
Have a great evening.